Is Pride Month, and in healthcare, it's an important time to reflect upon issues of healthcare equity and access for people in the LGBTQ plus community who can have poorer health outcomes than the general population due to discrimination and bias. Joining us now to talk more about this topic is Mia Dubois, Associate Vice President of Patient Experience for Northern Light Health. Mia, thank you so much for joining us. So let's start by kind of understanding the scope, the size of the problem. How serious of an issue is healthcare equity access for the LGBTQ plus community?
It's a pretty significant issue. We know that the LGBTQ plus community have less access to the healthcare that they need. They're also less likely to have health insurance. They're more likely to put off getting care when they need it. And they're also more likely to report poor quality of care and unfair treatment by their healthcare providers.
Are there any areas of medicine or healthcare where this is more true or more the case?
Yeah, the behavioral and mental health care areas certainly come to top of mind. We know that the LGBTQ plus community are at greater risk of eating disorders, mood disorders, having anxiety, and struggling with suicide. There was also a study done in 2022 by the Trevor Project, and that showed that right here in Maine, our LGBTQ plus youth Mainers had a 43% chance of seriously considering suicide, and 71% of them reported symptoms of anxiety, which is pretty high.
Yeah, definitely eye-opening, eye-popping for sure. So what kind of measures have been put in place at Northern Light Health to kind of address this equity and the access and the need for the LGBTQ plus community to have access to health care?
You know, we've spent a lot of time over the past several years doing a lot of training with our colleagues across the system to educate and engage them in conversations about the role that they play and all the barriers that our community members face when we're talking about lowering these barriers. We're encouraging our colleagues to ask about pronouns. We've also created ways to identify a patient's preferred name on the medical record if it's different from their legal name to ensure that we're being respectful. We've also added questions to our patient experience survey, asking patients if they were treated with dignity and respect while in our care. We take all that feedback really seriously. We put a lot of thought into it because we're always looking for ways that we can do better and we can improve and take the best care for our patients.
Yeah, and I'm looking here. Apparently there was a video produced by Northern Light Health talking about asking patients about race, ethnicity, culture, gender identity, things like that. Can you tell us a little bit more about that video?
Yeah, this was funded through an IHI and Pfizer grant. The goal of the video was to educate not only the general public, but also our healthcare providers about the reasons why we ask the questions that you mentioned earlier when patients come to see us. And that reason is because the best way to treat and care for a patient is to know as much about them as we really can. It's our responsibility to make everyone feel welcome when they come and see us, and that leads to better health outcomes for everyone involved.
All right, Mia, thank you so much from Northern Light Health. We appreciate you joining us. A really important topic, of course, not just this month, every month, but it's nice that we can highlight and underscore how important it is to have access to care for the LGBTQ plus community. So we appreciate you coming on the show, Mia. Thank you so much.